What is VYALEV? VYALEV is a 24-hour infusion treatment for advanced Parkinson's disease to help control symptoms, increase the on-time, and decrease the off-time. VYALEV is given under the skin using a wearable pump Vyafuser and works all day and night. VYALEV works by increasing the level of dopamine in the brain, which helps Parkinson's disease symptoms that are caused by low levels of dopamine. VYALEV contains Foscarbidopa and Foslevodopa, which increases brain dopamine levels. VYALEV FDA approval was granted on October 20, 2024, and is indicated for the treatment of motor fluctuations in adults with advanced Parkinson's disease. FDA approval was based on positive results from the Phase 3 M15736 clinical trial. VYALEV infusions extended the on-time periods without troublesome dyskinesia by an additional 1.75 hours compared to the group using oral immediate-release Levodopa Carbidopa. Specifically, VYALEV provided 72 hours of on-time, while oral Levodopa Carbidopa offered only 0.97 hours. Additionally, VYALEV significantly reduced off-time, improving symptoms of Parkinson's disease. VYALEV is also called Produodopa in other countries, and the pump is called Vyafuser. How does it work? VYALEV is thought to work by increasing the amount of dopamine in the brain. VYALEV mechanism of action MOA is a prodrug combination of Foscarbidopa and Foslevodopa, which are converted in the body to Carbidopa and Levodopa. Levodopa works in the brain, where it is then converted to dopamine, and Carbidopa stops the Levodopa from being broken down, which means there is more Levodopa available to be turned into dopamine. Levodopa and Carbidopa working together results in an increase in dopamine in the brain, which is thought to improve tremors, body stiffness, and other symptoms of Parkinson's disease. VYALEV side effects. Common VYALEV side effects are infusion site reactions, with pain 26%, skin redness 27%, infection 19%, and swelling 12%. Other common side effects include hallucinations and involuntary muscle movements dyskinesia. These common side effects occurred in at least 10% of patients in clinical trials and were greater than oral Carbidopa-Levodopa group. Serious VYALEV side effects. Serious VYALEV side effects include hallucinations, compulsive urges, reactions or infections at the infusion site, heart problems, worsening glaucoma, and withdrawal, emergent fever, hyperpyrexia, and confusion. Hallucinations. Hallucinations are seeing things that are not there, hearing sounds, or feeling sensations that are not real. This is a common and sometimes serious side effect of VYALEV. Tell your healthcare provider if you have hallucinations. Unusual urges. Some people taking certain medicines to treat Parkinson's disease, including VYALEV, have reported problems with gambling, compulsive eating, compulsive shopping, and increased sex drive. If you or your family members notice you have unusual urges or behaviors, talk to your healthcare provider. Infusion site reactions and infections. This is a common and sometimes serious side effect. Some people using VYALEV have had reactions and infections at the infusion site. Warning: VYALEV may cause sleepiness and falling asleep during activities of daily living. This may require discussion with your healthcare provider. Who should not take VYALEV? You should not take VYALEV with a non-selective monoamine oxidase MAO inhibitor medicine, or have taken a non-selective MAO inhibitor within the last 14 days. Ask your healthcare provider or pharmacist if you are not sure if you take an MAO inhibitor. How should I use VYALEV? VYALEV is given as a continuous infusion under the skin over 24 hours, using a Vyafuser pump. It can be stopped for brief periods of time, such as when taking a shower or a short medical procedure. The VYALEV pump is small, about the size of 2 stacked cell phones, and has a range of carrying case options. Your prescribed VYALEV dose will be programmed into your pump by a healthcare provider and should only be changed by your healthcare provider. You will need to change your infusion set tubing and cannula and rotate to a different infusion site if you stop the infusion for longer than 1 hour. If your infusion has been stopped for less than 1 hour, you will not need a new infusion set tubing and cannula, and you will not need to rotate to a different infusion site. If your infusions have been stopped for longer than 3 hours, consider also giving yourself a loading dose to quickly get your symptoms back under control. Have oral Carbidopa and Levodopa available in case your treatment with infusion treatment is stopped for 1 hour or longer. Do not stop using VYALEV Infusion unless you are told to do so by your healthcare provider. Talk with your healthcare provider about what to do in case you are unable to use the infusion. Always keep a supply of backup oral Parkinson's disease medicines that contain Levodopa and Carbidopa with you at all times. Use the infusion exactly as your healthcare provider tells you to use it. Only use this medication by yourself after you have been trained in the right way to use it. Ask your healthcare provider if you have any questions. Dosing information-based continuous VYALEV dosage and hourly infusion rate. The continuous infusion rate is based on total Levodopa dosage TLD. The hourly base continuous infusion rate MLHR TLD x1. 240 number of hours the patient is typically awake, e.g., 16 hours. See detailed dosage page for directions. Maximum VYALEV dosage. The maximum recommended daily dosage is 525 milligrams of the Foslevodopa component, equivalent to approximately 2,500 milligrams Levodopa. Preparation and administration instructions. Preparation: use an aseptic technique. Use sterile, single patient. Use infusion component syringe, infusion set, and vial adapter qualified for use with the pump to infuse VYALEV. Do not dilute. Do not mix VYALEV with other products. The medication vials are for single dose only. The entire contents of a vial should be transferred into a syringe for administration. Do not withdraw a partial portion of the vial contents. Parenteral drug products should be inspected visually for particulate matter and discoloration before administration, whenever solution and container permit. Patients should be trained on the proper use of this infusion before starting treatment. VYALEV should be administered subcutaneously, preferably in the abdomen, avoiding the area with a 2-inch radius from the navel. Rotate the infusion site and use a new infusion set at least every 3 days. Select new infusion sites at least 1 inch from sites used within the previous 12 days. Do not infuse into areas where the site is tender, bruised, red, or hard to the touch.